Chapter 1 Introduction. First of all, let me introduce myself. My name is Nibbana Siva with last digit 121, and this is the background of our paper. Some men think that penis size is important in their life. In fact, many men also experience excessive low esteem and ultimately affect their mental health. This was enforced by obtaining a figure of 45% of 25,594 healthy men want a large penis size. From this fact, sometimes some men look for alternative ways to increase the size of their penis. One of the most common is injecting silicone into their penis, which can eventually cause penile. In order to make an accurate analysis and diagnosis, Siliconoma penis needs to be well studied. And this is the problem identification, the objective, and the benefits of our papers.
Hello everyone, my name is Erika Luis with last digit name 089. Now I will present about the definition of Siliconoma penis. Penis is connected to an ancestral understanding of man's fertility and sexual performance, which is why it serves as the primary means of affirming one's own masculine identity and gaining the partner's pleasure. And as a result, many patients feel inadequate and uncomfortable, even when their physical and structural characteristics are within the range of normal. So siliconoma is basically the result of injecting a highly viscous fluid, often silicone, into the penis with the intention of increasing its size and functionality. That's all from me. Next slide will be presented by my colleague. Thank you.
Hi, my name is Caitlin and my last three number is 138. The epidemiology of Siliconoma penis said that there are 43 cases of men suffered from symptomatic siliconomas of the penis that are treated around 2010 and 2015. The mean age of patients was 37 years, and the main presenting reasons given indication for surgery were infection and sexual intercourse difficulty or obstacle for 26%, followed by ulcers 19%, persistent pain 16%, chronic inflammation 11%, and extensive phimosis 7%. In Indonesia, the data concerning penis formation with content substances as silicone was limited, probably because injection actions was mostly done by non-medical personnel.
Hello everyone, my name is Fiona Natalia Santoso with my last three-digit student number ID are 249. Now I'll explain about the etiology of Siliconoma penis. So men will be always looking for many ways to increase their size of masculinity, and it can be done by the injections of medical and non-medical substances, and also can be occurs by the sterility of the procedure by the non-professional. That's all about the etiology. The next presentation will be continued by my friend. Thank you.
Hello, my name is Adrianus with the last three digits of my student ID number 104. As for the pathophysiology, it is caused by a silicone injection to the penis. It's usually done to increase the size of the penis. After the injection, a local inflammation will occur. Later on, the silicone will move to the lower connective tissue, and infection will happen as there is a foreign object trapped inside the tissue of the body. To be specific, the penis. Characteristics of the inflammation is the formation of granuloma that contains living components and the silicone itself. In the histopathology field, another area will replace the connective tissue when smeared using hematoxylin and eosine or Adjani.
Hello, my name is Amanda Devasya Kusuma and my last three digits of student number is 068. And now I will explain about the diagnosis. Siliconoma of the penis occurs as a result of injection of high viscosity fluids such as silicone or other types of mineral oil which aim to increase the size or change the contour of the penis. The diagnosis can be made by examining the genitalia. In some patients, the mass is painless to become fibrous, hard, painful, or sometimes ulcerative. The skin becomes sensitive at the injection site, often with pigmentation or a dark yellowish discolorations, and usually glandular and cavernous bodies are not involved, but sometimes are the coronary sulcus is affected. That's all from me. Thank you.
My name is Maisa Zakariasa with my last three digits of my student number is 230. And today I'll explain about the management. The purpose of management is to restore the penis function as a sexual organ and track for body fluid with an acceptable appearance of the penis. Treatment is primarily surgical, in which the granulomatous tissue is excised. Wound closure will depend on cosmetic appearance, tissue mass, and risk of graft contracture. Silicone injection should be performed solely by trained physician using medical-grade silicone, whereby a granulomatous reaction could lead to serious consequences because of lack of response to the treatment. That's all from me. Thank you.
My name is Adjani Sayidina Pakpahan with the last 3 digits of student number 031, and I would like to explain about prevention. Infection and patient or partner dissatisfaction are the most common complications of penile silicone implants. Preoperative, intraoperative, and postoperative factors play a role in preventing infection. For example, using the conventional no-touch technique reduces the risk of infection significantly. It involves changing gloves, irrigating the operating fields with antibiotics, cleaning surgical tools with antibiotics, and adding more sterile drapes. Regarding partner and patient satisfaction, preoperative counseling regulates patient and partner expectation to prevent postoperative problems brought on by discontent. The patient must be adequately educated about the procedure, the implanted device, potential complications, and the need for informed consent. That is all from me. Thank you.
The next slide will be presented by me, Nilputri Mahaputri, Kaika with last 3 digit number 155. Complication. So local complications include pain, erythema, ecchymosis, pigmentation, tissue induration, and excessive elevation. There have even been cases of reported complication where the penis become oddly shaped because the silicone was injected in a location far from where it should have been injected. More severe complications occur such as a granulomatous reaction resulting in deformation of cellulitis with nodules, ulceration, skin induration, and local limb enlargement. Systemic complications have also been reported after the injection of large amounts of liquid silicone, such as acute pneumonitis and granulomatous hepatitis. The pathogenesis of granuloma is not clearly known due to the entry of foreign bodies. However, there is an assumption that silicone-induced granuloma, presumably there is involvement of the T cells with increased levels of tumor necrosis factor or TNF-alpha. That's all from me. Thank you.
Hello everyone, my name is Anastacia and Tanberius, and my last 3 digit numbers are 154. And here I'm going to explain about the prognosis. So, on a study performed by Hamza et al., following a surgical excision due to siliconoma penis, patient was given prophylaxis of IV augmentin for 3 days. After 6 weeks, graft is fully healed with full penile length on erection and normal sexual intercourse. However, most patients who undergo these procedures is unsatisfied with the results and shows more complications than good. Even patients with no complications still complains about discomfort and decreased sexual potency. Hence, we can conclude that the prognosis of siliconoma penis procedure is unfavorable to poor.
My name is Dewi Putri Sakaraja Serikanini with the last 3 digit number 188, and now I will tell you the conclusion of our student project. So, siliconoma of the penis is a result of injecting a highly viscous fluid, often silicone, into the penis with the intention of increasing its size and functionality. The silicone can cause a number of unfavorable inflammatory reactions, such as granuloma and tissue necrosis. The use of silicone implants in the penis has also been reported to cause various other complications, such as pain, erythema, ecchymosis, pigmentation, tissue induration, and excessive elevation. The diagnosis of penile siliconoma can be made by examining the genitalia, and the goal of management is to restore the penis function as a conduit for body fluids and sexual organ with an acceptable appearance of the penis, with surgery as the main treatment.
My name is Bonifasius Alvianto Pamungkas with lesson number 137, and in this occasion I want to explain about the advice of our student project. Siliconoma penis is a clinical problem that clinical practitioners need to be aware of. Clinicians must be able to examine properly and be able to manage this disease properly. Clinicians, especially in Indonesia, also need to do research about epidemiology and find its difference from other regions. So we are in the end of our presentations. Thank you for the attentions. And we would like to apologize if there are any mistakes from us. And we will close it with Paramasanti. Om Santi 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 Om.